This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. In a time of pandemic, we certainly need a health show.
We do, John.
So
we do.
That's what we're here for every Sunday, 8 till 9, Talk Radio 1210 WPH.D. We do our best to get you and keep you healthy here on the show, and that's why we call it Health Watch, with the one and only Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We discuss, as we always say at the top of the show, the who, what, when, where, and why of Innovative Medical Associates. And if you have a question, you have a thought, you have really an issue you want to discuss with Dr. Molly, as a lot of people do here on the show, this is the time to call in. 855-839-1210 is our number. 855-839-1210. Again, our show, Health Watch, every Sunday, 8 till 9, Talk Radio 1210 WPHT. I guess in addition to everything else, Dr. Molly, you're doing your best to keep people healthy.
I'm trying, right?
I see more and more new faces.
Thank you, John.
And innovative,
And unfortunately, you know what I see? More and more new faces who come in after they have a challenge.
Right.
As opposed to people who look at maintaining health, right? So you and I talk about this all the time. The healthier you are, the better off you are. And we know that hydration, nutrition can help keep you that way.
And the earlier you go, the better it is, right?
Right on. You know?
I mean, and it's interesting because you're now in your 24th year. And,
I am.
And we've talked about this all the time. That people come in to you and say, Dr. Molly, I've been everywhere and I just can't get any relief.
Or I'm in stage 4 cancer. And
right.
I say, well, how long have you been diagnosed? Oh, 4 years ago. Well, how about coming in? I'm the firm believer that you don't get cancer the day you're diagnosed. But if on the day you're diagnosed, you start looking around for additional or augmented treatments, as well as your conventional, whatever that is. And you know I'm a proponent. If you have a tumor, get it out. If they can get it out, get it out. But you ought to be with me right after that.
Right. I wanted to ask you, because I was watching sports, and they said, well, he went into the locker room to get an IV, and it was one of the Eagles players a few weeks ago.
Wow.
And so I was thinking of you, hydration.
Yeah.
Talk about that, and why is it so effective?
Well, hydration is effective in many ways. But first of all, we're able to really give an appropriate dose of certain nutraceuticals. I think in the case of the athlete, what you want to do is you need to get the fluid level up, but you also need to get him electrolytes, because he's probably out there sweating up a storm. And we all know that electrolytes are very important. Just look at your TV and look at all the things that are out now, the smart waters and this. I'm using the generic term, by the way, smart water.
Right.
And also, for the kids, the Pedialytes and all of those things. So, and all the waters with vitamins and minerals. Now, the question is, what's the most direct hit? IV therapy, hydration therapy. That's the most direct way to rehydrate the body, get it back to homeostasis, and then get on with your day. So, yeah.
And we should mention that's pretty much the philosophy of Innovative Medical.
It has
hydration
been for
therapies.
23 years. It is a cornerstone. It's not the only thing we do. It's not the only trick in our black bag, but it is the cornerstone. It's the one we reach into first, because through that, we're able to deliver a lot of other God's ingredients that can effectuate the change for the patient.
I noticed, like in my bag, it's like a orange color.
Yes.
And I know you put a lot of things in there. So
right. But actually something that I put in your bag this is interesting, is actually a blue. By the time it gets to you,
it's orange.
It's
okay.
orange.
Okay.
But it's a very interesting thing. And I don't use this particular product for everyone. Again, I'm using it for you because of your history of the particular type of, I would say, cancer challenge that you had.
So you're able to put, not just in my case, but in other cases, you're able to put in a variety of ingredients.
Right, natural.
And deliver them via hydration.
Right.
to help the particular medical challenge.
Exactly. And more importantly, not only do we help the challenge, but what we're really doing is helping your quality of life through your challenge. And that really is very important. Actually, this weekend I was attending one of these conferences remotely, which is very interesting. And one of the things that came up, because it's an international conference, which I like better than our regional conferences, because the international folks, the physicians in Europe, etc., they really look at everything differently. They are able to give the same type of ingredients and same type of drugs that we have here. They are. But they look at outcomes so differently. They said, yes, it's really important to have the double-blind studies, but not as important as getting your patient well. And that's been my philosophy for all of time, right?
Yeah.
It's quality of life that counts, not just the quantity of the numbers in your lab work.
You have some patients, like myself, who have been coming for 20 years, and you have other patients who are just starting. It seems to run the gamut from one to the other. But talk about kind of a norm of what people can expect. They come in to see you and they get the consultation, then they go into the treatment.
Depending on what is the underlying challenge, we know that we can't solve this challenge in one visit. Can't be done. We know that people are going to need a course of hydration. How do I know that? I know that from the data that I've collected over 24 years. We've had people come in for one hydration and leave. That's not going to do it, folks. I mean, if it's an acute situation, it might for your electrolytes, it might. But when we're looking at people who truly have a health challenge, you're going to need a series. And generally, it's between 5, 10, 15, 20, or 30 weeks.
And then there's maintenance after that.
Yes.
If you choose.
Right. And what I would do is encourage you to keep the maintenance, because why do you want to ruin your reserve? We've got you tuned up. It's like your car. Okay.
Yeah.
I really, you get your tune up, right? Whatever time, 15,000. I mean, in these new cars, it's what, 20,000, 30,000, like that. Okay, great. Good. But don't you have to go back for the oil change? Don't you have to go back maybe to have these tires checked? Don't you have to change the air filter in your car? You're darn right you do. The same thing is true for your body.
So you have to do that maintenance to maintain the reserve that you spent all that time building up.
And money on, which, by the way, if you look at the cost of coming into us as opposed to traditional treatment, drop in the bucket. Completely opposite of what I say about our hydration, which is a mega dose. In terms of cost, our cost is nowhere near what happens when you have to go into the hospital, et cetera.
Oh, well.
And the new drugs.
We could talk forever about that.
Right.
I mean, because that's like buying two houses.
It is. It really is.
If you go into, but let's talk about some of the ingredients. I was watching TV this morning, and here's a commercial for this vitamin does everything, because it has vitamin D, vitamin C. Yeah, it has all that. I'm thinking to myself, how can one product have all of that in it?
Oh, it can, but in minuscule doses.
Right.
I mean, when you come to see us, you're going to get a very, very, I would say, robust hydration, and we can include the products you need. Here's the other thing. Why would you take something, whether it's a pharmaceutical or a natural product, if you don't need it? If you don't need it, why would we give it?
Right. Okay. So we have plenty more to talk about here on the show. Our first break of the morning. Our program is Health Watch, and you'll find us here every Sunday, 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Number here in the studio, 855-839-1210. You have a question, give us a call. We're happy to talk to you, and we always tell you, call as early as you can, because we don't want you to get shut out. We find that happens every week. About 3 minutes left in the show, and everybody calls us. 855-839-1210. We're coming back with more of today's edition of Health Watch after these words. Welcome back to Health Watch. Operators standing by as always during the course of the show. 856-489-0505. That's the number you call for Innovative Medical Associates if you want more information, or most importantly, you want to sit down and talk to Dr. Molly about your issues and your situation. And that's the initial consultation, and that's what you want to schedule 856-489-0505. 856-489-0505. Also, you can get a lot of information on the website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good info on that as well. Do want to remind you that Health Watch is replayed every Sunday here on Talk Radio 1210 WPHT. It's our Health Watch replay. Sundays 4 until 5. 4 until 5 p.m. every Sunday right here, WPHT, Talk Radio 1210. 855-839-1210 is our number right now here in the studio, 855-839-1210. And again, it's Health Watch every Sunday, the live version, 8 till 9 here on Talk Radio 1210 WPHT. You know, Dr. Molly, we often talk here about the age range of some of the patients.
Oh, sure.
And the other day I'm sitting in the chair and I see a young girl come in a wheelchair. And I'm thinking, wow, she's really young. And I figured
she is really young.
18, 19.
Exactly.
And
beautiful
then she
girl.
Start talking. Her mother was with her.
Yeah.
And she's in a wheelchair. And I'm thinking, boy, this reminds me of Michael all over again.
It does. And what's interesting is you hear her say, we're so happy to be here because she has greatly improved.
Yes.
And you're looking at her in a wheelchair.
Right.
Well, let me tell you this story. This young lady came to me on a gurney when she first came.
Wow.
That means she's laying flat, folks. Her legs were outstretched flat. Okay, blanket over her. The kind of gurney you might see in a hospital ward where they're running you around the hospital, okay? Mom is a nurse, by the way. Mom's a registered nurse. Bring her in, and I hear the whole history of this patient. I have medical records that probably were 2 boxes big. Reviewed the medical records with the mother. Mother kept very, very precise and accurate records. Anyway, the story is this. She went to 5 other physicians and started treatments with them and continued their treatments, both conventional and non-conventional treatments. Very interesting case because in looking at the history, you see that she had a tick bite that they couldn't possibly say it was absolutely Lyme. But when you look at her clinically, I would say it probably was Lyme. And what you have to do is you can't just look at a Lyme titer. This is why I say to you, just don't go by lab results. You need to do some specialized tests that then will look at some of the bacteria and viruses that the Lyme gives the patient in the bite. And lo and behold, she had 2 of them. And now you can imagine she's had this since she was like somewhere around 15. She comes to me, she's 18. She's now 19. Make a long story short, she wasn't able to go to school, whatever. I treated her with, of course, large doses of vitamin C, some natural antivirals because that was part of it. Antibiotics. Traditionally, my docs were in the case. I said, I think we need to look at this case from all facets, and they agreed. And so we put this protocol together. We treated her with all of the natural substances and certain specific substances, again, that were antiviral in nature, meaning natural, like things like melanorin, lysine, those kinds of things. IV, mind you, through the hydration, along with vitamin C, D, etc. I could go on and on. Glutathione for her liver. Then we got to a point where I said, I think it's time for us to try EXOMES. EXOMES, EXOMES. That's extracellular material that helps the cell signaling, and it helps restore the cell signaling in specific areas. For example, in this case, she had a hard time walking. That's why she was confined to the gurney. She couldn't move her legs or bend them. Do you believe this? Yeah. Unbelievable, right?
It's really...
you had to see the case,
I
folks.
know.
So anyway, we treated her with exomes and stem cells, as well as a cocktail of cytokines, etc., to enhance the effect. This was about 3.5 weeks ago. Well, guess what? She is going to physical therapy. She's moving her legs. She still can't walk. She has to use a walker, but she's in college. She was not able to finish her high school at the high school, not because of Corona, but because she was confined to the gurney.
All right. Can you explain a little more? peptides and exomes?
Well, the peptides are short chains of amino acids, and there are essential amino acids that the body has that are building blocks for the cells. Here's the problem, folks. In our bodies, in particular organs and functions of the body, there are over 100,000 biochemical reactions every day. Your mitochondria, the powerhouse of the cell, is active. It's like your power plant, right? You need all of these biochemical chains, these biochemical reactions in order to live. This happens from the day you're born to the day you die. And here's the thing, without getting enough of certain substances, forget about it. You're off track. It's like you're wandering around without a map, right? You can't get to where you want to go. And in this case, we wanted this young lady to start to have feeling and some cell communication in the muscles in her leg. So you can be sure that I'm giving her peptides that work on muscle tissue, and that's what we did. And I'll be darned if it's not working.
So there's a big improvement so far.
Right now.
Now, what is the obviously?
Next step.
Yeah, what's the next
right
step?
Now, we brought her down to every other week, but I still want her to continue twice a week with physical therapy, and she's going to a specialized physical therapist that works with muscle contraction, particularly with people with MS, those kinds of issues. Because the whole premise of this was they were saying there was nothing wrong with her. They thought it was in her head. They thought she just didn't want to go to school.
Yeah, we've seemed to have heard this before, right?
Many times. And by the way, you know what they were treating her with? Antidepressants, anti-anxieties. A kid, 18 years old. Well, if you're not depressed at the beginning of your treatment, you think you're going to be depressed in it? You sure as heck are.
Absolutely.
So this was the case that I think this year, at least the year that's passing me by right now, 2020, along with coronavirus, that I think has got to get into my new book. So.
Yeah, I'm waiting for that. By
it's
the way.
coming out.
Okay.
It's coming out. But you know, I've been doing several other things.
Yeah,
so,
I know.
yeah.
But back to this case.
Yeah.
What
Isabel.
Isabel, what is her future like? Is this going to be an ongoing thing for the rest of her life?
I think Isabel is going to have to make sure that she maintains a healthy lifestyle, because the bottom line is health can't occur unless you maintain a healthy lifestyle. So, yes, she's going to have to maintain this by oral, I'm sure. I've already got her down to once every other week because of the progress that she's made. I'm fairly confident probably in 6 months, I probably will be able to get her down to once a month, and then ultimately to once a quarter, and then ultimately to orals and those kinds of things. And probably only come in for a tune-up once every, maybe twice a year.
So the prognosis
if she wants to.
Right, is very good.
It's very good.
Right.
It's very good. The fact, her mother said, the fact that she's able to attend college 3 days a week for 3 courses each day is a big step. Here's a kid who wasn't in a classroom for over 2 years. Can you imagine?
Jeez.
I mean, you know, a very bright girl, again, comes from a great family. She said she's thrilled to be able, she used to play sports. She used to do all those things. Can you imagine being stuck in a gurney and people telling you it's in your head? And she couldn't walk, 2 steps without falling.
Boy, oh boy. I tell you, it really...
I had to see this case.
I saw her, and I said to myself, we have to talk about this on the radio because...
Well, talk to her mother.
Right, and I was like, I was fascinated because it's rare. I mean, you do have young people,
yeah, of course.
but for the most part, it's older people. But when you see a young person...
Not dead people,
No,
John.
I know.
We're older, but we're not dead.
Not yet, right? We're still alive and kicking.
Middle-aged people, sure.
But I was like fascinated. I said, there must be a challenge here.
This is a testament to the fact that, we can't take things like Lyme disease lightly. Oh, you were bit by a tick. Big deal. No, I had someone else who is our age who came in and said, I was bit by a tick. I said, did you save the tick? Why? I said, because I can send that out and be tested to see if it's even carrying these particular viruses or bacteria that may affect you. In the meantime, get in the chair. I really need to start pumping you with certain nutraceuticals that may preempt this thing.
You have had a lot of success with Lyme. I know
yes,
that. Yeah,
no
you've
question.
had a great deal of success
No
with
question.
that.
No
but it goes to the point of traditional treatment sometimes doesn't
It
doesn't hit.
What it does is it effectively wipes out, quote unquote, the Lyme disease, but it does not wipe out the comorbidities, the other diseases that can come from the additional bacteria and viruses that are implanted in the body. And more importantly, let's think about this, John. How about if you're not quite up to par in terms of your health when you get bit? The chances are you're going to end up with a residual problem.
Right. Your old friend chelation, we're going to talk about that
I love it.
later on in the show, which is how you cut your teeth.
Yes, that's right.
We always love talking about that. So we are coming up on another break here on the show. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi. We have plenty more to talk about here on the show. Don't forget our Health Watch replay this afternoon, 4 until 5. I know some people say, I go to church on Sunday morning. I sleep a little late. We go to breakfast. Okay. So then that's what we have the replay for. Okay. And that's coming up 4 to 5 this afternoon here on Talk Radio 1210 WPHT. More of today's edition of Health Watch. And again, our number here in the studio, 855-839-1210. More of today's edition of Health Watch right after these words. And we are back here on Health Watch. And, of course, the operators are back. They're always here during the show. And they're here after the show. And they're here this afternoon. So if you want to talk to the folks at Innovative Medical, give them a call right now, 856-489-0505, 856-489-0505. That's the number, Innovative Medical Associates. You want to get some more information, they'll be happy to give that to you. And you also want to sit down with Dr. Molly and go over your issues, your situation. You want to set up an initial consultation, which is absolutely complimentary. You can do that as well right now. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. And as I said before, we do have the Health Watch replay every Sunday from 4 until 5. So if you miss any of our show or you want to hear it again this afternoon, 4 to 5, Health Watch replay every Sunday here on Talk Radio 1210 WPHT. Of course, our show is Health Watch right now. 855-839-1210 is the number here in the studio, 855-839-1210. And Dr. Molly, we mentioned before the break that you cut your teeth on chelation.
Sure.
And we are also going to talk about that and bring it up again. The question of the day is, how can health occur in a toxic body? That's what you want to answer.
That's right. It can't.
Okay.
It cannot. So the question is, where are these? How do you get these toxins? So we know, for example, getting coronavirus, that's putting your body at risk. That's a toxin. Viruses are toxin. We know bacteria is a toxin. You can get sick, and that's a toxin. People who have cancer, they've got an invader in the body, and now we've got to deal with it. But there are also environmental issues like mold and fumes and additives. Of course, the biggest one, everyone sees the commercials for Roundup, right?
Yes.
I mean, they are everywhere now. And, it's really amazing because in America, we have something like 10 times more fatalities related to Roundup than they do in Europe. Isn't that unbelievable?
Yeah, that is.
Even though Roundup is found there on some of the farms, the larger vineyards, those kinds of things, they don't have the fatalities and the conditions associated with it like we do because, of course, we use so much of it. So, when you have something like that, you're actually looking at a twofold situation. Yes, you have to use a chelator, which means to claw out the invader and get the body back to homeostasis, which means the Goldilocks theory, the balance, not too much, not too little, right in the middle. But you've got to look at the outside things that contributed to this, the fumes, the actual part of ingesting the particular constituent in Roundup that causes cancer. That's a problem. It's in runoff. Mold is another one. Mold. And I go back to toxic fumes because I had a case just this week, an executive from a particular hotel chain, who really was suffering what I would consider respiratory issues and this kind of stuff. And here I find out that he has an office in a large hotel that's right next to or right near the bus terminal in Philly. Now, figure that one out.
Wow.
What do you think he's getting? So, of course, I sent out for the blood work, and he tests positive for MTB, which actually is a particular additive that we use in gas, and it's in the fumes. And probably these buses running in and out, and gosh only knows about the ventilation in his office. But the point is, I said to him, well, I can help you. But as long as you're still back into the problem, into your office, you're going to be continued to be exposed. He goes, well, I'm already feeling better. I said, that's good. But the point is, we've got to eliminate the exposure, which is why I'm now very, very interested in environmental medicine. Yes, we have chelators, EDTA, DMSO. There's so many other ones, and you use them appropriately for what you're trying to do. Vitamin C is a chelator, beautiful dosing. But if you don't remove the catalyst to the problem, meaning if you go back into your home and you don't have your home tested for mold and you go back into the mold, what do you think is going to happen? You're not going to feel any better.
Exactly.
So
yeah.
Guess what? I don't even want to take your money. That's the thing. When we look at a patient, you can understand. I'm looking at a patient I'm really looking at the patient holistically. Where do they live? What do they eat? What kind of, how do they sleep? There's just so much. And you've got to look when people present with mold and those kinds of things, you've got to look at the environment.
Did you tell him to get another job?
No, I didn't do that. But he said he might get a transfer, which would be good.
Yeah.
Go out to Denver or somewhere where it's nicer
than
the air quality in Philly.
I wanted to ask you, because we started talking about chelation. Wasn't that used like way back?
Yes.
Way back in
Yes.
time for like people who had lead in their system?
It really was developed right in Philly from Exide Battery at the time, because it was an occupational modality, meaning it was done out of the occupational health, because if guys were exposed to lead, we all know, and since the 50s, that lead is very detrimental to the body, another particular constituent. So yes, but in doing that, they found out in the data that all kinds of things improved, including their lipids and including their vascularization, which means blood flow from head to toe. So then chelation became popular for cardiac issues, and it's still today popular with a lot of folks. Now, the key to chelation is, yes, you do a series of chelation. We start to see the lipids come down. We can send you out for a calcium scoring, which is beautiful today. We didn't have that 23 years ago. And we can look at that and see the reduction in the calcium, and therefore know that the chelation is working.
It's so interesting because you started out with this, and I remember that's all we used to talk about.
Right, because that's how I cut my teeth in hydration therapy, actually.
And you still use it, but there's so many other things.
But now I not only use the chelation, so for example, I have a whole family that came in, a father and two sons. And they just started with me. It turned out that one of the sons had chelation before, and the doctor that he went to sent him to me. I don't know why, except maybe they were closer to our office, and he just gave him my name. But to make a long story short, his lipids look good, so he's been following a good diet. He's been doing what he has to do, but he felt it was time to come back in and get his tune-up for 10 treatments, and I think I agree with him. But the dad has many comorbidities along with high lipids, and he's already had 2 stents put in. He needs to keep those stents open. Now, he's a man in his 80s. His brother is a man in his 50s who also has been stented already. Now, listen to this. The gentleman who had the chelation has none of this. The other 2 who haven't had any chelation have stents, and they also have diabetes problems. So, of course, I'm going to work on both of them.
I want to ask you this because, everything that you talk about is so interesting and is so kind of like cutting edge. But I know you get this question all the time, and you've talked on the show about the success rate of a lot of your cases. But when people ask you, well, Dr. Molly, I hear you and all this, but for me, does this really work? So can you answer how you would answer that question?
Well, how I answer that question is, listen, everything is in God's hands. But if you follow a regiment, okay, and you just follow the regiment, and we start to see the improvement in your numbers, that's one thing that I look at. So if you come in with cholesterol that is, 500, and after 10 treatments, we got you down to 275. Well, are you there yet? Probably not. You might need some more, but we want to talk. But how are you feeling? Well, I can walk further. I don't have pain on walking. I don't have angina on walking. Oh, I didn't need to, stop and to catch my breath. Those kinds of things happen, and it can happen pretty quickly if a patient follows what we tell them, not just because of the chelators, but because of the things we give you in addition to that. That's where we're a little different.
And I would suppose that also a lot of people come in, I hear you say this in the office too, it's not holy water.
I agree. It's not holy water.
They would come in and their expectations are, well, 1 or 2 treatments, I'll be fine, and I'll be on my road to recovery.
No. And it doesn't work like that. Actually, what's so funny? I had a call this week from another physician, from a physician. Actually, they were calling, I think, to give hell to my medical director. And I get, me, I got on the call, and he said, you're the one I want to talk to. He said, if I could do anything, I'd put a medical hex on your clinic. I said, a what? A medical hex. I said, well, why, doc? I said, I absolutely believe that if you need a stent, you put it in. If you absolutely need bypass surgery, you put it in. Yeah, but people don't get that part. Well, what part are we talking about? Well, we're talking about that you're talking about chelation and that it works. I said it works in lots of cases. It works and it works well, but it doesn't work as quick as opening up a vessel with a surgery. I always say that.
Yeah, I know you.
But if you want to have that intervention, go ahead. Please don't put a hex on me. I said, bottom line is, I believe the medical hex is sometimes from the traditionalists, really.
Well, it's called selective hearing.
Yes,
is that
yeah,
right?
yeah.
Okay. Coming up on our final break of the morning, you still have time to jump in if you have a question or a thought for Dr. Molly. 855-839-1210 is our number here, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Again, our number here in the studio, 855-839-1210. We do have some open lines, and we do have a few minutes left on the show, so you have time to jump in with your question or your comment, or maybe you have a medical challenge and you want to run it by Dr. Molly, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. More of today's Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical. Now, just because we leave you at 9 o'clock doesn't mean they leave. They're there. So if you want to call and get more information, feel free, 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey, and the website innovativemedicalassociates.com. A lot of good information on that, innovativemedicalassociates.com. Don't forget, Health Watch replay this afternoon, 4 till 5, and every Sunday afternoon here on Talk Radio 1210 WPHT. Health Watch is our show. Sundays, the live version, 8 till 9, Talk Radio 1210 WPHT. Before we get back into the show, and we got some callers, Dr. Molly, your good friend John Merlino.
Yeah.
Getting older and better, huh?
Well, I like to say he's going to be 39 again.
Okay.
So God bless you, John, on your birthday.
Okay. We're going to the phones. Gary's in LBI. Gary, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Gary.
Good morning,
How are you
Dr.
guys?
Molly.
How are you guys?
Gary from Long Beach Island.
Yeah.
Doing good.
Good.
Got a good question for you. One of my dear friends for over 30-some years, as a child, he had chronic asthma, and he's been sucking on that atomizers with the little cartridge in it for 30-some years.
Yeah.
And now he's got to the point just lately where he can't go up the stairs without running out of air.
Oh, my gosh.
And I thought, well, I better just run this by you and see if there's anything that could happen that you could make a lot better for him.
I think there is, Gary. I think there is. First and foremost, boy, I would like to have him come. I would love to see his pulmonary function test. Okay, and that would be a step one. And is this gentleman? He's an adult at this point, right? He's a young guy.
Oh yes, yeah.
Okay, great.
No, he's 68
well,
years old.
He's a young guy, Gary. Come on. So listen. So yes, I think we would certainly use our good old friend NAD, but more than that, I would probably use I would probably do something with hydrogen peroxide and glutathione. And believe it or not, Gary, you can use glutathione in a nebulizer, and I've had plenty of people who are doing it. Oh, have him call the office, please, and I would love to talk to him. Thank you. Thank you for that call.
Gary, thank you. Appreciate it.
Thank you for that call. That's a great call,
yeah,
John.
It's a great call.
And it tells you that, again, we're not just using the hydration. We can use a nebulizer. Go ahead.
Okay. Vernon is in Phoenixville. Vernon, good morning. You're on Health Watch with Dr. Molly.
Hi, Vernon.
Good morning. Wonderful show.
Thank you.
The calcium test. You mentioned something about the calcium marker test.
Yeah, the calcium scoring. Calcium scoring. Yes.
Is that specific to the coronary arteries, or is that body-wide?
Well, there are some places that are actually doing, let's say they're doing body CTs, yes. But the ones that I'm most familiar with, Vernon, is actually the calcium scoring and the cardiac CT. So they will actually do a calcium score as well as a cardiac CT, which actually tells us some other things. So yes, and it's very prevalent, and there are certain times of the year that you can actually purchase that test. You don't necessarily have to go through your insurance, and it's generally around $150 in our area, and we use it a lot, Vernon, a lot. And I'll tell you get a lot of good information out of it, because it actually allows us to have a score that goes from good to very, very bad or very high calcium, in which case we then look at what are the chelators that we can use to improve blood flow. I want to also say, though, it does pick up calcium on the outside of the coronary arteries, meaning the calcium score may be affected by how much calcium is on the outside as well as the inside. But nonetheless, it's a good baseline scoring test. Yeah, ask your cardiologist about it. Go ahead.
Well, okay, so if you find somebody has a high score,
yes.
We have arteries throughout the body. So the idea, I guess, if it's high there at the cardiac level,
sure,
then you probably have it up there at the carotid arteries, and then maybe the penile artery.
That's right. That's exactly right. And indeed, that's what happens. But when you look at EDTA, which is part of the chelation protocol, EDTA improves blood flow head to toe 12%. And I will tell you something, in terms of men's health, and everybody knows about the new process that's out there that actually helps men, revive the arterial and the the vessels in the genitalia. We actually have been doing that with EDTA for quite a while. In other words, if you do a course of chelation plus that, almost 100% functionality come back.
Okay, well, you said plus that. You mean the low wave? Are you talking about the shock therapy?
Yeah. I'm talking about the low. Yeah, I'm talking about the low wave, which I think is a wonderful thing. Okay, you'll never get I think it's wonderful. You do a short course of chelation with that. Absolutely unbelievable.
Okay, Vernon.
Okay.
Thank you, Vernon.
Appreciate your call. Thanks a lot for the call.
That was a nice call.
Yeah.
Thank you.
What do we always say? Try to call early, and we
here we go again, right?
Here we go. It's deja vu all over again. Okay. Real quick, I know you attend in days gone by. You attended seminars. We don't have them anymore. We have them virtual.
Right, and I'm attending them right now.
Right. I was just going to say.
Yeah, I've got about 18 hours this weekend.
You were telling me about what you're doing and the seminar and some of the data supporting what you've been doing for a long time. So just briefly give us that.
They're talking about the dosing of utilizing some of the nutraceuticals. And apparently, see, when you have a bunch of guys together, in the game or in the racket, I like to say, you hear things. And it's funny because I've been using large doses of nutraceuticals specific for certain things for a long time. When people are in crisis and they come in, I believe that the larger dose might be needed to help them get through the crisis. For example, high doses of vitamin C. I use pretty hefty doses. And then you bring the patient back. Once they get into a situation where the crisis is handled, then you can bring them back to, let's say, quote unquote, the normal protocol dosing. So my protocols are a little bit challenging in that they're different than other people's.
But talk about the data that they were.
Well, they were saying that you might need higher doses in crisis. And I said, well, I've been doing that for at least 20 years out of the 23. And they went, oh, well, great. Maybe you would want to share them with us. I said, well, not really, but definitely larger doses in crisis. Now, the question is, you got to get familiar with that, and your staff has to be familiar with that, because, again, I tell you all the time, the object is to bring somebody back to homeostasis, which is the Goldilocks theory, back in balance.
And, it's interesting. Everybody wants to get into the act, right? They want your protocols, right?
I know. But, I'm not inclined to do that.
No, and you won't. I understand that. Yeah. But it was just sort of, a reinforcement of what...
Actually, it took me by surprise, really, because they were talking about that. And it's a funny thing, because their large doses and my large doses are two different things.
Yeah. Well, guess what? It's time to put the wraps on it.
Well, John,
thank you. Time flies when you're having fun, right?
Thank you.
That's going to put the wraps on another edition of Health Watch. Don't forget that the operators are standing by at Innovative Medical Associates right now at 856-489-0505, 856-489-0505, and they will be there well after we leave you at 9 o'clock this morning. So you're listening to Talk Radio 1210. You call the operators. They'll be happy to accommodate you. And remember, the initial consultation with Dr. Molly is complimentary. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, and we have our nurses, Jess and Crystal, and of course Barbara, fabulous Franny, delightful Dee, and our medical assistant Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a safe and a healthy one. We'll do it all over again. Oh, don't forget our replay this afternoon, 4 until 5. We'll do it all over again, the live version of Health Watch, next Sunday, 8 till 9, here on Talk Radio 1210 WPHT. You take care.